Hello, hello.
Can you hear me?
Yes,
Okay,
you
how's the
just stopped
sound
by.
on
I
that? I'm
saw.
using how's that go? Is that
Yeah,
clear?
sounds good.
Okay. Is the lighting good? I can turn on. Let's see. I have I
I'm gonna
have
make it full screen on
two.
that one for you. Let's take a look.
I have several things here too. I can do the lighting. Just let me know.
Okay, try the earlier one.
Okay, just tell me when to stop.
Uh, This one better. This one's good.
Okay, wait, let
The
me go
earlier one, yeah.
back.
This one's
This
good,
one?
yeah.
Okay. That's off basically. Okay.
Yeah, otherwise, yeah, that's good.
Okay.
Do you want to try to share a PowerPoint and see it all
Yeah,
working?
let me do that.
Let's do that.
Um, I'm just not going to use the presenter mode. I'll just share the full. Wait, let's see. How do I do this? Is it desktop or just my PowerPoint? Maybe I just do my PowerPoint. Does that?
Yep, we just see the PowerPoint.
Yeah. I
Yeah,
don't
it
know if there's
loads
a way
perfect.
for me to do my notes, but I don't think so.
Oh,
Do you?
do you have a one screen or two screen on your
I
computer?
only have one screen.
Yeah,
Yeah.
one screen that won't be able to do the,
Yeah. Okay. Just
the
that's
screen.
fine.
Okay.
Yeah. Okay.
Like, sounds good, Michelle. So we're gonna get
Okay.
about 15 minutes, take a little rest, and then we come back.
All right. So I'll turn this off.
Yeah. Thank
Okay.
you.
Great. Yep. Um,
Recording in progress.
Hi everyone. Testing, testing. 1, 2, 3. Can you hear me? Awesome. All right, let's get started. Good afternoon, everyone. We are so excited to welcome you all to eLotus's free webinar today. And as you may have also heard, we will be doing a giveaway, so be sure to stay tuned until the end of today's webinar to see if you win. My name is Myra Chen, and I'm your host and moderator for today's eLotus webinar. Here at eLotus, we have been hosting educational courses for over 3 decades, and we are proud to be your trusted source for premium CEU content with over 200 speakers, 700 courses, and 3,000 hours of CE. We truly appreciate you all for joining us today. Now, I think all of us have friends, family members, or patients who have been affected by cancer, and we know how devastating and difficult it can be to treat. These are the cases that stay with us, reminding us why this work matters so deeply. And today, we're incredibly fortunate to hear from 2 leaders advancing traditional East Asian medicine into mainstream oncology through published research and real-world practice. It's an honor to welcome Dr. Michelle Loy and Dr. John Chen as they share their work and vision for better, more integrative cancer care. Today's webinar is an opportunity to learn, connect, and explore insights related to the newly published article on perspectives of integrative medicine, integrating traditional East Asian medicine dietary and herbal therapies for supporting cancer treatment and survivorship in the West, sponsored by Evergreen Herbs. I'm honored to introduce our first speaker today, Dr. Michelle Loy. Dr. Loy is a nationally recognized physician who embodies the future of integrative medicine. with training from Harvard, Weill Cornell Medical College, and Columbia University, and board certification in integrative medicine, lifestyle medicine, medical acupuncture, and pediatrics. Dr. Loy brings together scientific rigor, clinical depth, and whole person care in a way that is both rare and deeply impactful. Beyond her clinical work, Dr. Loy is a visionary educator and leader, shaping integrative medicine at a national level while mentoring the next generation of physicians. Her work spans nutrition and botanical medicine, women's and children's health, integrative oncology, and TCM, all grounded in a profound commitment to healing, prevention, and human connection. I'd also like to introduce our second speaker, someone who you may all know already, Dr. John Chen, a leading authority in both Western pharmacology and Chinese herbal medicine. Dr. Chen also serves as the herbal consultant and quality control director for Evergreen Herbs and plays an active role in global TCM education and advocacy through organizations such as the American Herbal Products Association, the American Association of Acupuncture and Oriental Medicine, and the US FDA. To learn more about Dr. Michelle Loy and Dr. John Chen, I will share the links to their speaker pages shortly. Also, if you're interested in more courses related to oncology, I highly recommend checking out Dr. Chen's course, Herbal Safety in Breast Cancer, Caution, Contraindications, and Interactions, Dr. Jonathan Locke's course, Optimizing Cancer Support Using Acupuncture and Herbs, Dr. Su-Hong Lo's course, An Overview of Current Western Medical Practices in Clinical Oncology, Implications for TCM Practitioners, and Dr. Peter Shang's course, TCM and Western Approaches to Colon Cancer Care. I will put all the links to these courses in the chat room for you shortly. And if you're a Gold Pass member, you probably already know, but for our new attendees, our Gold Pass members get access to all of the courses I mentioned, as well as our eLotus library of over 3,000 hours of video footage for one entire year. There is no shortage of CEUs to take. Plus, sponsored benefits. This includes a 10% discount from Helio and an Evergreen Herbs Collection Formulas voucher from Evergreen Herbs that is equivalent to the amount you paid for the Gold Pass. If you have any questions about the Gold Pass, please type them in the chat and I'm happy to help. And before we begin, a quick reminder to please make sure to set your chat from hosts and panelists to everyone so we can all be part of the conversation. To submit any questions during the presentation, please use the Q&A box so they don't get lost in the chat room. This video recording will be available in 2 business days in the free TCM resources section of our site. And yes, we truly wanted to do something meaningful today. So in addition to Dr. Loy and Dr. Chen's generosity in sharing their wisdom and insights with us today, for the first time in eLotus history, we're offering one lucky attendee a full year of access to all of Dr. John Chen's video recordings. That's 35 complete lectures, 152 hours of teaching, valued at $2,207. This is not just a giveaway. It is our way of supporting you as a practitioner. Because when you deepen your knowledge, your patients feel the difference. This is about giving you the tools, confidence, and clinical insight to help the people who trust you with their care, especially in the most challenging cases. Please stay with us until the end of the webinar to be eligible for the live drawing. We're very excited to give back to our TCM community and invest in the work you do every day. And finally, we want to extend our sincere gratitude to our speakers for sharing their time, knowledge, and experience with us today. And without further ado, please join me in welcoming Dr. Michelle Loy and Dr. John Chen.
Thank you so much for your
Hi,
kind
Michelle.
invitation.
It's a pleasure to have you.
Hi.
Well, hello?
Hi. Can you hear me?
Okay. Yeah, so Dr. Loy will be our first speaker. Let's give her a big show of hands online, and we'll give the podium to her.
Thank you so much for the kind invitation. Can you
Thank
hear me? Are
Yes.
you able to hear me? Okay, excellent. So, as you know, I am a board certified in integrative medicine and lifestyle medicine physician, and I work very closely with the oncology teams. And I also deeply respect the depth and the clinical wisdom of traditional East Asian medicine. So today, my goal is very practical. I want to help you understand how oncologists think, how to communicate in a way that they can hear, and explore how TCM practitioners can meaningfully and effectively integrate into cancer care, especially in the Western medical system. So I have no relevant disclosures, and the objectives I've already discussed. And I hope to offer some resources and ways to continue your professional development. I'll start off with the definition for integrative medicine from the American Board of Integrative Medicine that I'm a part of, and also the Consortium of Academic Health Centers. And as you know, integrative medicine really affirms the importance of the practitioner-patient relationship. It's focused on the whole person. It's informed by evidence, is very evidence science-based, and makes use of all appropriate therapeutic approaches, healthcare professionals and disciplines to achieve optimal health and healing. And what's most important is that it's under the collaborative care of an integrative medicine physician. The NCCIH has I really love this diagram because it shows the whole picture. We have medication, we have drugs, we have nutrition, we have psychological therapies, physical therapies, and of course, relevant to today's discussion. Of course, we have dietary therapy, we have herbs, botanicals, of course, acupuncture, Tai Chi, yoga. So this is all part of whole person health. So why this matters, there really is a need for shared language. Many of our oncology patients commonly use TCM, like herbs, dietary therapies, acupuncture, and they may or may not be telling their oncologists about what they're doing. On the other hand, oncologists have concerns about safety, interactions, toxicity, treatment interference, and so coordination is very, very important. And there is definitely a way where we can meaningfully integrate both. You can read all the details in the paper that Dr. Chen and I wrote, highlighting these two cases, which I'll introduce to you a little bit now. The first case was an 84-year-old woman. She had stage 4 bladder and kidney cancer. She had failed immunotherapy, which the family was very discouraged by because they felt very lucky to have the opportunity to take the immunotherapy, but she had a lot of side effects, fevers, and issues with her feet, and she had to discontinue it. She came because her daughter had read a lot on her own. Actually happened to be Asian family, and she wanted to basically put her mother on a plant-based diet. But the mother was not doing so well on that. And so she came for a consultation. And during that time, we discussed, we did a whole intake and ultimately offered her some dietary with some food type herbs to help her mother. And so here the symptom burdens were high. She had elevated glucose levels. She had foot ulcers. She had fatigue. She was wheelchair bound, and she was recovering from all the side effects from her immunotherapy, which was not working in her case, unfortunately. So I'll tell you just basically, and you can read in the case. Initially, before she had been giving her mom, omnivorous diet, but including meat, and then over the past month, she started giving her mother only cold vegetables, salads, sprouts. She cut out all the grains, no meat, and it was a very cold diet. And the mom was asking, is there any way she could eat some of the foods that she enjoyed, like soups and a whole list of other Asian foods, which the daughter was, out of trying to, the goodness of her heart and trying to do the very best, was not giving her. And so we talked a lot about how we can do both. It's not one or the other, but we can integrate Western nutrition and TCM dietary therapy. And this you're all familiar with, but these are slides that I share with some of my other Western colleagues. TCM dietary therapy includes all of Western dietary therapy, the macro, the micro nutrients, the fruits, vegetables, grains, protein, of course, minimizing artificial processed foods, but also adding in the thermal nature of foods, the 5 flavors with their therapeutic actions, the seasonal based eating and activity, and very importantly, honoring the individual constitution, their stage in life. In this case, going through cancer, as we know from a TCM perspective, it's a very cold condition. And in some cases, some of the actual therapies are actually temperature-wise cold, right? Cold capping and things like that. And it's interesting because many times I have patients come and I'll see them, they're wearing their winter hats and their gloves and their jackets, even, maybe even during a warm season. And they're telling me that they're trying to force down a cold kale salad that their, well-meaning relatives brought them, thinking that would be the best for them. And then we discuss, what does their body desire and crave, and perhaps maybe considering, like a soup might feel better for them. So these are some of the conversations that we could have, and the conversation that I had with this family. And so, of course, there is the Western dietetic calories, protein, carbohydrate, but also the food energetics that we know from TCM related to the season, related to the meridians, the the energetics. And we talked a lot about the thermal nature of food, the types of food, adding things like astragalus and ginseng and root vegetables in her case, and actually all kinds of vegetables, because initially she was only giving her mother vegetables 1 time a day because she couldn't tolerate it, because the salads were just too difficult and the sprouts were too difficult for her to digest. And so we talk about the types of plants, the state, whether it's raw or cooked. Generally we recommend cooked, the color, and the cooking method. And of course, the different body constitutions and the principle of yang shen, tuning into the body's wisdom. And then, of course, there's a lot of overlap between food therapy and TCM herbalism. The use of, I feel that, almost all our patients really can benefit from food therapy. And then in certain cases, we can use TCM herbs. So there are a lot of overlaps there, right? Many of the herbs are actually come from food. The second case is another patient I had, a 65-year-old. She had metastatic breast cancer, and she was experiencing endocrine therapy-related insomnia. And so we, after a comprehensive intake, we decided to talk with her about Swanzao and Tang. In addition to a comprehensive sleep support plan, we talked about exercise and yoga and CBT and lots of other support plans, magnesium. Of course, she was on her standard medication. She was on letrozole and Verzinia and her other medications. And she responded very well also to the Swanzao and Tang. She only needed it for a little while, a couple months, and she was doing much better. So in both these cases, they had enhanced quality of life, and in this case, treatment adherence without adverse effects. And actually, I saw this patient as a follow-up just a few months ago, and she was doing very well. But she had some fatigue, which the oncology team thought was related to her chemotherapy, the cardiotoxicity. And so she was asking about some other herbal therapies, which we are considering with the whole team to help with that, the cardiotoxicity and the fatigue, and also as well as her, she had some acid reflux, and so we were thinking about using another potential formula as well. So she was very, she did very well with the Swanzao Rentang, and so was asking for some other potential herbals that could potentially help support her through this. So different clinical scenarios. In one case, it was more of a hospice type situation. This case is more of a survivorship, different risk profiles and different flexibilities. So, of course, we definitely talked about TCM dietary therapy with in both cases, and then did more of the herbs with the second case. This is a wonderful paper that I always share with in all of my talks from Jason Howe and Jun Mao and their whole team wonderful team at Sloan Kettering, the top reasons for herbal prescriptions. And this is something that I will share with the oncologists when I speak to them. And you could see so many different reasons for herbal prescriptions. And some of the common ones that we may use are listed here, whether for mood or fatigue. So the Shenmai San, that's the one we're thinking about using for the second case as well. Insomnia, we talked about GI, Balho Wan, and a lot of others here. So I will, it's very important that we have communication, safety and timing matters. Collaboration is very important, both for the outcomes and also to establish trust. And it's best when we frame TCM in terms of safety, function, and outcomes rather than ideology. Remember, oncologists prioritize evidence, even imperfect evidence, risk-benefit analysis, which of course is very important, predictability and standardization, and this has to always fit within the institutional policy. So if we don't address the risk, then oftentimes they won't hear the potential benefit. So, perhaps one thing I might suggest is instead of saying there are no interactions, it might be more helpful to say, here's what we know, here's what we don't know, and here's how we'll monitor. And so avoiding TCM only language without translation, not being dismissive of conventional care, not positioning TCM perhaps as an alternative, and not recommending herbs during active treatment without coordination, and sort of shifting from alternative to more of an adjunctive supportive type language. And so, focusing on a clinical goal like nausea, neuropathy, or fatigue, discussing timing, discussing the safety protocol, how will we monitor, and the willingness to pause or adjust. This really mirrors how physicians already think. And when we translate these TCM concepts into biomedical language, we're not abandoning the TCM theory. It's more of building bridges. So instead of saying strengthening spleen qi, we might talk about appetite or digestion, supporting qi. We might talk about immune resilience, clearing heat. We might talk about inflammation or mucositis or cytokine effects. So this really helps them hear the benefits. So here's an example of a few slides that I use, actually both when I speak with fellow physicians, but also this is part of my oncology group visit that I share with my patients. So I'll give an example of Ma-zi Ren-wen, which is, constipation is very common, very distressing. And so I'll explain to them, okay, these are what the herbs are, they're mostly foods actually, hemp seed, apricot seed, and rhubarb. And I'll show them the publication. And then I'll explain to them how it works, right? It stimulates intestinal mucosa, decreases water absorption, softens stools, and it's an alternative to chronic laxative use. And then I'll show them the different clinical studies, review how they're They've been shown to be well tolerated and effective in randomized controlled trials, even in children, and even discuss the bioactive compounds that are within each of these foods or herbs. And then discuss the precautions for someone with tree nut allergies, or if someone has a non-functional constipation with underlying pathology or pregnancy, or someone with, deep spleen qi deficiency, and very importantly, if someone is on a blood thinner, right? So we will discuss the precautions. And then very importantly, it's part of a comprehensive plan. It's not in place of fluid and high fiber fruits and vegetables and of probiotic rich foods and being physically active, right? And promoting gut motility and managing stress. So this is part of a comprehensive plan. If we use clear Latin and common names, discuss doses and timing, duration, the purpose, and any red flags, this helps build trust. Because hospitals really value willingness to follow institutional guidelines, oncology literacy, research familiarity, flexibility, and reliability. So these are some of the group visits that I run at my at our center. The Living Well with and After Cancer one we've been doing this for a number of years. We've published on it. And these are the 7 different topics that we cover in the series. And in this, this is a couple, next few slides come from one of the sessions that I do with my patients. We talk again about food-based herbs. We talk about, I give them this recipe for adding things like astragalus and mushrooms and turmeric, burdock into their foods. Very easy. You can use like an Instant Pot. Or I'll encourage them to try like a shabu shabu. Some of the patients are not that familiar with some of these foods. And so after we talk about it, then I encourage them to try that. And this came from a talk I gave at a medical acupuncture conference where we talked about how to use kanji and the different foods we can recommend to patients. And then we had a demonstration, a tasting. So you might want to consider additional training. Of course, all of Dr. Chen's work and his textbooks and all of his webinars and from eLotus. Another actually really great course I'd recommend that I took it is the herbs course that they have at Memorial Sloan Kettering, and it has CME. It's a very, very, very helpful, very, very good course as well. Also, following the research, and shortly, Dr. Chen's going to talk about how research can be very, very important, how it plays out globally, and he'll use the example of Huanqi Tang as an example. But even case series and safety data and pragmatic trials really do matter, because research really reassures the conventional physicians, even when the mechanisms are incomplete. So the take-home message is that patients need both systems working together. We need to be coordinated, work together. Safety and timing matter. Language builds trust. TCM practitioners are essential, and the language has to be understandable to biomedicine, and collaboration integration is very, very important. I'll just show you a few resources, books that I've found to be very helpful. These are more on the TCM dietary therapy side. And then as far as, here are some of the papers that you can access if you'd like. Of course, Dr. Chen's books here. This is an app that I found to be helpful for those who aren't familiar. And places to get trained for dietary or culinary medicine. Here are some of them that you can look into. And again, I want to put another plug in for the Sloan Kettering TCM Herbs course. And then these are some resources on herbs and supplements The Office of Dietary Supplements is a good one. PubMed, of course, natural medicines, and the MS About Herbs website I use a lot. Consumer Labs, HerbMed, these are all very helpful. This is the course, Herbal Formulations of Cancer Supportive Care. And then herb drug interactions. I often will use PubMed or up-to-date drug interaction checker, or if you have the if you're lucky enough to have a pharmacist at your institution to do the drug herb interaction, then that would be really helpful. And these are some of the references, and those are my emails if you want to reach me. So I'm going to stop my share and turn it over to Dr. Chen. I may mute myself.
Okay. All right. Thank you so much, Dr. Loy, for your presentation. And while we prepare for Dr. Chen to take over, we will play a brief introduction to Dr. Chen's work on the clinical manual and how to look up herbal alternatives to drugs in the clinical manual. That is free to access for all the attendees today. We'll be right back.
All right, welcome back from break, everyone. With more practitioners implementing telemedicine and using herbal medicine in their practice, there's a need for some pointers on modern uses, research, and applications. This is the start of something great for herbal medicine because it's the best way to help your patients remotely and earn an alternative form of income. The clinical manual has been said to be the best guidebook of what herbal formula to use for specific disorders, what TCM and Master Dome points to use, auricular points, dietary and lifestyle recommendations, herb drug interactions, lab results, and so much more. This book is a collaboration of the top TCM practitioners in our industry, including Drs. Richard Tan, Jimmy Chang, Chuanmin Wang, Li Cheng Huang, John Chen, Nat Van Beskoten, and Cole Magbonwa, just to name a few. There's no need to reinvent the wheel. Most of the herbal formulas are put together by top herbalists like Jimmy Chang and John Chen's teachers. It's very difficult to go wrong with prescription if you're following the manual. So what if you have a patient who is currently taking pharmaceutical drugs, but interested in Chinese herbs as an alternative because of all the side effects from the medications? How do you safely prescribe them herbs? And what would be the herbal alternative? With the help of Dr. John Chen, the clinical manual makes it incredibly easy for you. You can look up the drug name by its brand or generic name to figure out the herbal alternative. You can easily find herbal alternatives to their cholesterol, hypertension, allergy medications, and help your patients to a more natural path of wellness. For those of you worrying about potential herb-drug interaction, Dr. Chen has also created an easy-to-read chart that you can print out and post on your clinic wall of the herb-drug interaction chart. These are drugs with higher risk of interaction with herbs, and also it tells you what you should do if you encounter them. This chart is invaluable not only to prevent possible harm to your patient, but also prevents potential malpractice lawsuits. Best of all, it's free for you, courtesy of our sponsor, Evergreen Herbs. The clinical manual is a modern directory of Chinese medicine, as everything you need to hold your hand through clinical practice, and the rest is up to you. I'll share the link and access information with you here in the chat room. If you have specific questions, please feel free to email me directly at info@elotus.org. And everyone here gets free digital access, so no matter where you are, you can always access the clinical manual. as long as you have internet connection. The link is also on the course access page, so be sure to save or bookmark it so you will have forever access to it. We hope you will utilize this to start your journey on becoming an herbalist. This is the perfect opportunity if you are looking to start. All right, so let's go ahead and get back to the class.
All right, testing. Just making sure everybody can hear. Okay, sounds good. All right, thank you, Dr. Loy, for a wonderful presentation. I first met Dr. Loy last year in Seattle when we did a presentation on integrated medicine together. And I just love her approach to presentation, and I love her presentation and her approach to helping her patients. And the reason is because I think most TCM practitioners, we have a private practice and we practice solo. And that obviously has a lot of challenges. So what usually happens is when we have patients that come in and they are cancer patients who are going through chemotherapy and radiation, we really want to help these patients because we see them suffering from all the side effects of chemotherapy and radiation, and there are a lot of things we can do to help these patients. But then inevitably, what happens is these patients then go back to talk to their oncologist. And generally, one or two things happens. The oncologist will either tell the patient to absolutely do not take any herbs and supplements. A lot of times it's because they don't understand what the patient is taking, or they are just lukewarm or neutral. They don't know what to recommend or what not to recommend, and they don't know about herb-drug interactions. So oftentimes, even though we really want to help these patients, our hands are tied because the oncologist just strongly discourage the patients from taking herbs. And this is why I invited Dr. Loy to share her experience with all of us, because even though her background is a medical doctor, as you can tell, she knows quite a bit about TCM, not just the herbs, but also all the diet and nutrition and so on. So I think we can definitely learn from her perspective how we need to act, what we need to learn in order to really practice integrated medicine and also to help the patients who are going through chemotherapy and radiation and suffer from all the side effects. All right. And overall, let me share with you these couple of literature really quick, not to go into the details, but just from a bird's eye view. So this is an article that was published in 2022 called The Real World Evidence of Traditional Chinese Medicine Treatment on Cancer, a literature-based review. So basically, it's an article that reviews many articles that are published. And the point I want to bring to your attention here is that in China, more than 4 million people are diagnosed with cancer every year. Hold on one second. Okay. How far do I need to go back if I need to? Just one slide? Okay. Okay. So as I was saying, I think we need to approach this concept of integrated medicine and how to best treat patients. First, from the bird's eye view, and then we'll narrow down. So this is an article that talks about the real world evidence of traditional Chinese medicine treatment on cancer, a literature-based review. So what I want to point out in this study is that it highlights that in China, more than 4 million people a year are diagnosed with cancer every year. And then among these patients, more than 80% of these cancer patients have received traditional Chinese medicine treatment, indicating that traditional Chinese medicine has an irreplaceable position and importance in the treatment of malignant tumor. So in short, basically what that means is that in many of the Asian countries, whether it's China, Taiwan, Japan, Korea, Singapore, and so on, Chinese medicine and Western medicine are both considered to be mainstream medicine. But specifically in cancer, what happened is most patients do go through consultation of both sides and receive Western medicine cancer treatment. But at the same time, they also seek out treatment with TCM practitioners. So as you can see, 80% of them do end up being treated with TCM as well. And in this case, most of the treatment, whether it's acupuncture, herb, diet, nutrition, and so on, are focused usually as an adjunct. So to help to strengthen the immune system, to help to support the health, and also more importantly, to alleviate the side effect associated with chemotherapy and radiation. So in Asian countries, this is a very standard practice where the patient are treated with both Western medicine and Chinese medicine at the same time. Okay, this next article is titled Prevalence of the Use of Herbal Medicine Among Patients with Cancer, a Systemic Review and Meta-Analysis. And this was published in 2021. And basically what it says in here is that in this global meta-analysis reported approximately 22% overall herbal medicine use among cancer patients, with about 18 to 21% in North America and Europe. Broader review and meta-analysis confirm herbal and botanical use during treatment typically falls in the 15 to 30% range in Western settings. So overall, the exact percentage vary a little bit from different regions, but you can roughly say that in the Western settings, you have somewhere between 20 to 25% or so of the cancer patients as they go through chemotherapy and radiation, that they also use botanicals or herbal treatment. So as you can see in the Asian settings, it's roughly about 80%. In the Western setting, it's only about 25% or so. So the question then is, how do we close that gap? How can we better inform the patients and also the healthcare practitioners so we can provide better healthcare overall to these patients? And I think the answer is twofold. We need to go bottom up, and we also need to go top down. Bottom up refers to educating the patients, educating the general public, and basically help one person at a time. Okay, so that approach is kind of slow, but it's very important. And what usually happens is you may have, let's say on average, 10 patients that comes in and they want to take herbs, but some of them are very afraid. Others, the oncologist may tell the patient no herbs and no supplements. But what happens is every once in a while, you may have a patient that have to drop out of chemotherapy because of side effect, because of adverse reactions. And then at that point, you are then free to use herbs because there's no issue of interaction because the patient is no longer on chemotherapy. And what you usually find is that this patient will recover so much faster while taking herbs that will then trigger the curiosity from the oncologist. The oncologist will ask the patient, and then maybe you, what are you doing that's so different? Why are you recovering so fast? So that is your window of opportunity to then introduce TCM to these patients and oncologists, okay? And that is the bottom-up type of approach. The other to that is the top-down. And by top-down, I mean to access all the medical literature out there about the benefit of herbs from a research perspective. And I would say in the first 10, 15 years of my practice, there is not a lot of research that have been published in medical journals. But in the last 5 or 10 years, they are actually quite a bit. And in fact, any Chinese herbs or herbal formulas, if you go online, go to
PubMed, you should be able to find a lot of information. So Dr. Loy mentioned 酸枣仁汤 earlier. She mentioned 麻子仁丸, astragalus, and so on. So all these herbs, all these formulas, you can really find a lot of information. And then one formula I think probably has most information, and I would jokingly say this is probably the most famous herbal formula, is one called Huang Qin Tang Scutellaria decoction. And the reason is because this doctor here, Dr. Chang from Yale, he started to do research on this formula probably around 2010. And since then, you have Wall Street Journal that picked up his research, as well as many other institutions and academia. And the reason is because there is not a lot of research on Chinese herbs in which the research is geared toward researching the formula to have it go through different phases of FDA approval process and hoping that one day it becomes an herbal drug. So this is the early stage in which Wall Street Journal first picked up on the research and about this formula, Huang Qin Tang. So in case if you're not familiar with it, here is the quick background of this formula. It's a very simple formula from Zhang Hanlun co-induced disorder, and it's about 1800 years old. It's a simple formula with only 4 ingredients, and they are Huang Qin, Radix scutellaria, Bai Sao, Radix peonia, Gan Cao, glycyrrhiza or licorice, and Da Zao, jujube or dates. And historically, it's used for treating DMP, dysentery, for patients that have mild fever, bitter taste in the mouth, abdominal pain, diarrhea, dysentery, red tongue, yellow tongue coating, and also rapid pulse. So basically, patient with dysentery, diarrhea characterized by DMP. And in this case, if you were to say DMP to a medical doctor or somebody with Western training, basically DAM is a more referring to a localized problem, and heat is referring usually to some type of infection or inflammation. So it's a localized infection, inflammatory condition affecting the intestinal tract. Okay, and these are the 4 herbs. 1 is Huang Qin, Scutellaria. 2 is Bai Sao, white peony. 3 is Da Zao, jujube, and 4 is licorice. Okay, and this is the phase 1 study of the formula. And phase 1 usually refers to the safety study. So basically, this is a study that studied this formula, and it's abbreviated as PHY-906 for treating patients with advanced colorectal cancer going through chemotherapy. And to make a long story short, basically what they find is that PHY-906, which is Huang Qin Tang, is an herbal preparation based on, from Orient, that's over 1800 years old, to treat a wide variety of gastrointestinal disorders. And this is a formula that protected against weight loss associated with irinotecan treatment. And in the presence of this herbal formula, mice were able to better tolerate otherwise lethal treatment of this drug, significantly improve anti-tumor activity and the overall survival observed in the animal study. So basically, what they were able to demonstrate is that use of this formula along with chemotherapy drug improve the effect of the drug and at the same time reduce the side effect of the drug. And not just with irinotecan, but also with 5-fluorouracil and also leucovorin. Okay, so with that, the study was able to continue. So from phase 1 to phase 2, and phase 2 is the early stage of clinical trial where the humans are now taking the herbs. So in this case, the phase 2 clinical trial is on the use or combination of PHY-906 plus capecitabine in treating patients with hepatocellular carcinoma. And again, they found that this formula, and this is now abbreviated as either PHY-906, which is the original name, or YIV-906, okay, to enhance the body's immune response to fight cancer and increase the anti-tumor activity of sorafenib, and also to protect and repair the gastrointestinal tract by reducing inflammation and promoting tissue regeneration. So basically, it's now describing this formula to have 3 main therapeutic effects. Number 1 is to increase the body's immune response to fight cancer and increase anti-tumor effect of the drug. So basically, it has synergistic effect to increase the effect of the drug, but at the same time, it has a protective effect to help to protect the body by reducing inflammation and also to promote the tissue regeneration. So the question is, how does it do that? What are the mechanisms in which this formula accomplishes that effect? And basically, as they dive a little bit deeper, what they found is that this formula exhibited anti-inflammatory effect by decreasing the neutrophils, macrophage, tumor necrosis factor, and other pro-inflammatory cytokines. So this is similar to many of the anti-inflammatory drugs. But what this formula was able to do that the drugs are not able to do, or they are not drugs available for these type of particular function, is that PHY-906 helped to restore the intestinal epithelium by promoting the regeneration of intestinal stem cells. Okay, so I think overall, this is the most important function of this formula. And the reason I say that is because Western medicine is quite effective in terms of treating the acute, in terms of treating the urgent situations. So they have very powerful weapons when it comes to cancer, chemotherapy, radiation, surgery, and so on. So that is beyond what Chinese herb or acupuncture can do. They also have very powerful chemotherapy and radiation. Okay, so in this case, what the herb is able to do to complement and also to go beyond the overall treatment is that Huang Qin Tang has 4 ingredients. So once again, Huang Qin, Bai Cao, Gan Cao, and Da Cao. So Huang Qin, Scutellaria, and TCM term help to clear damp heat. So like we mentioned, if you read the details of this herb, it definitely has a very significant antibiotic effect, anti-inflammatory effect. So if you're treating somebody with a bacterial dysentery or traveler's diarrhea, Huang Qin is definitely a great herb to use. It also has some anti-cancer effect, but I think by itself, it's probably not sufficient. But if you combine it with chemotherapy drugs or anti-cancer drugs, the herb seems to enhance the anti-cancer effect with the drugs. Okay, then what happened is you have 3 other herbs. Okay, so even though the formula is a formula that treats damp heat, dysentery, you have 1 herb that treats the damp heat, but you have 3 herbs that nourish in and tonify qi. So you have Bai Cao, Peony alba, which is white peony, that nourish in. Then you have 2 herbs, Da Cao, jujube dates, or Gan Cao, licorice, and Da Cao, jujube dates that tonify qi. So this is generally not the case with Western medicine, but with Chinese medicine is quite common, where you have 1 herb to treat the excess. So that's the infection and inflammation. But you have 3 herbs that treat the underlying deficiency. Because what happened is with the long-term infection and inflammation, that will then damage the qi and yin of the body. And how do you explain qi and yin in terms that Western practitioner can understand? Basically, how I would do it is to say that, I'm sure they heard of the term yin and yang, right? So yin and yang basically refers to the anatomy and physiology of the body, the form and functions of the body. So qi and yang basically refers to the function, and yin and blood refers to the form. So generally speaking, when we use herbs that tonify qi or raise yang, we are helping the body to increase the physiological function. When we use herb to tonify yin and tonify blood, we are helping to make changes to the anatomy and to the form. Okay, so when somebody has a bacterial infection and inflammation of the digestive tract, the function and form, the anatomy and physiology will both be affected. So not only do we have to treat the pathogen or the excess, we also have to repair the damage that has occurred. So Bai Cao, white peony, nourish in and is the one to help to restore the form. Gan Cao and Da Cao tonify qi, and they help to restore the function. And they have to be used at the same time because you cannot restore the function if the form is damaged. So basically, if the intestinal lining is damaged, then there's no way that it can perform the normal function. Okay, so you have to do both at the same time. And that's the beauty of Chinese herbal formulas, where you have a simple formula like Huang Qin Tang with 4 herbs. You have 1 herb that target the excess, and that's similar to what Western medicine does on a regular basis. But you have 3 herbs that help to restore the underlying damage and restore the function. And this is the part where Western medicine really have no answer for. So if you want to practice integrated medicine, this is the best way for TCM and Western medicine to integrate and to complement each other's, where one treats the acute, one helps to treat the chronic, one treats the symptom, one treats the cause. Okay, so this is the best way to bring the 2 sides together. All right. If you're looking for additional reference, you can get them at many different places. One is NIH, Office of Dietary Supplements, US Pharmacopoeia, PubMed. PubMed is probably the easiest place to go. You can go there, type in whatever keywords you're looking for. And then, generally speaking, like I mentioned, there are lots and lots of articles in the last 5-10 years on Chinese herbs. Okay, so what you might need to do is type in the pinyin names, type in the common name, or type in the Latin binomial or pharmaceutical names, because depending on how the article is published, some of the authors will use pinyin name, some of the authors will use pharmaceutical name, some of them may use Latin binomials. So when you're doing a search on Chinese herbs, try different approaches and try different perspectives. You will get much better results. Okay, and just on a side note, all my writings and all my presentations basically try to do that as well. I try to present an integrative approach where half of the presentation will be from a Western medicine perspective, and the other half will be from a TCM perspective. So I'm hoping the presentation and all my work will be a bridge that connect the 2 sides together. All right, so we have about 5 minutes left. So if there are any questions at all, Dr. Loy and I will be happy to answer your questions. And if you don't get to it, feel free to send us emails. We will definitely get back to you by email. Okay, Myra, do you want to see if there are any questions? I can see it. I just had the PowerPoint. Is Dr. Loy also on? Not right now?
I am on. I'm still here.
Okay. Dr. Loy, did you have a chance to go through the questions? Is there one you feel will be more beneficial for the audience?
Let me see.
Okay, I'll answer one question real quick. The question is, does Huang Qin Tang work in other type of cancer like lung? So the question really is not whether Huang Qin Tang work for specific type of cancer like lung cancer, but really what they are using this formula for is more to treat the side effect associated with chemotherapy. Because what happened is chemotherapy tend to have a wide range of side effects. And one common is that it tend to affect the cell that grows relatively rapid. And your digestive tract is one that constantly regenerates. So many of the patients will have digestive side effects, nausea, vomiting, diarrhea, and so on when they use chemotherapy. So it's not the cancer itself, but it's the side effect from the treatment that Huang Qin Tang is really trying to address. Okay, and what I also find fascinating is that Huang Qin Tang is one of the many formulas from Sang Han Lun, which is cold-induced disorder, and also Jin Gui Yao Lue, Golden Chambers Cabinet. So these formulas are quite old. These are 1800 years old, and they have definitely stand the test of time, because for any TCM practitioners who are going to school, you still have to study these 2 texts in order to graduate and get your license. So that's one of the strengths of Chinese medicine, where it's practiced in real human through clinical trial and error. And those that stand the test of time are the ones that we still study and use today.
I can answer the two questions about resources for TCM, dietary food therapy. There are a number of cookbooks and things. The 5-element cookbooks is very good. Healing with Whole Foods is helpful. The Tao of Nutrition, Ellen Goldsmith's book, Nutritional Healing with Chinese Medicine. These are a number of books that can be, among others, that might be helpful to you.
Okay. There's also a question on 麻子仁丸. 麻子仁丸 is an excellent formula because it's not a straight purgative. It's also not as straight laxative. And basically what it is, as with all Chinese herbal formula, is they are made out of many different ingredients. So what this formula does is it has a very gentle overall effect to help to increase the fluids in the digestive tract, and at the same time stimulate the intestines to increase peristalsis. So basically, for a lot of patients who have cancer, maybe they have very severe pain and they are prescribed opioids. And what opioids do is they dry up the digestive tract, therefore lead to very dry stools and very severe constipations. And if they take laxative drug for a long period of time, they often their constipation may be relieved, but if they take it for too long, then they develop habitual constipation. They may also have electrolyte imbalance. So the use of 麻子仁丸 helps to regulate normalize bowel movement without the same side effect. And it's also something that's quite safe. So you can take it for a long period of time. So as long as the patient is constipated, if they are taking opioids, they can still take the formula. So it's a good alternative to the Western drugs as far as patients that have opioid-induced constipation. Okay, so I think our time is up, so I'll go ahead and end it over here. And again, if you have any questions at all, you can send it to Dr. Loy, you can send it to me, or you can send it to Myra at Lotus, and we'll get back to you. And once again, I want to thank Dr. Loy very much for taking time out of her very busy schedule to share her experience with us. We really appreciate it. Yeah, and I look forward to working with her more in the future. And yeah, please, if you can, thank her for us. She took time out of her busy schedule to work with us. So we really appreciate her expertise and her experience. Do a drawing? Yeah. Oh. She is going to do a drawing and wrap up the class.
Testing, testing. All right, and before we end today's session, I just want to sincerely thank Dr. Michelle Loy and Dr. John Chen. Thank you both for your generosity, your thoughtfulness, and for the work you do every day to support practitioners, patients, and move this medicine forward. We truly appreciate you sharing your time, experience, and heart with our community. And now, the moment we've all been waiting for, our giveaway for a full year of access to all of Dr. John Chen's video recordings, 35 complete lectures, 152 hours of teaching,
$2,207. This is our way of saying thank you and supporting you as a practitioner to enhance your patient care to the next level. Rena, could you please share your screen? All right. And let's do a countdown of 3, 2, 1, and spin. Oroko Ogura. Awesome. Congratulations. You will get access to all the courses of all kinds of topics: herb-drug interactions, safety, herbal alternatives, oncology, and more. Awesome. We will email you the details for the giveaway within 24 hours. Please be on the lookout for the email from info@eLotus.org. All right. And there was also a question here about Michelle's contact information. Dr. Loy, if you would like to share that with our attendees, if they want to get in touch with you.
Yeah, it's mhloy@med.cornell.edu.
Thank you, Dr. Loy.
Sure.
Okay. And that concludes today's free webinar with Dr. Michelle Loy and Dr. John Chen. Thank you to everyone who attended, and we hope you gained new insights to enhance your practice. We hope to see you at our next webinar next Monday, February 2nd, 3 p.m. to 7 p.m. Pacific Time, with Mark Mastrangia for Acupuncture for Anxiety. Be sure to check out our live webinar calendar on eLotus.org to stay updated for all of our upcoming webinars. Thank you, everyone, and we hope you have a great rest of your day. Bye-bye.